Good afternoon, everybody. Welcome, Tawfiq. Thank you for joining us today. Thank you all for joining our webinar today. This is part of our webinar series that the Pearl Initiative have launched in response to the COVID-19 situation that is obviously creating a global impact. In light of the situation, Pearl Initiative transferred all of their events, workshops and roundtables to webinars so that we can still carry on delivering on our programmatic impact and supporting the ecosystem where we can. I know we've got a lot of new viewers, people that are not so familiar with the Pearl Initiative. Just to give you an introduction to the Pearl Initiative, we are a non-profit founded in 2010 to promote the business case for improved corporate governance, transparency and accountability across the private sector in the Gulf region. Since 2010, we've been working on our mission across a broad range of programs divided by sector and theme, and supporting the private sector. As of today, we are now trying to launch a new program in terms of the COVID-19 response to support the ecosystem in terms of the response going forward. We will be launching a series of webinars in relation to best practices and the actions that organisations have also taken regionally across the Gulf in terms of their responses to the reaction. Just to give you a quick introduction into the event today. Obviously, the COVID-19 pandemic is an unprecedented global health crisis. The disruption caused by the pandemic is no longer just a health problem, but it's also created social and economic implications that I think we're all privy to and have all been affected by in some way. The disruption is testing all segments of the global economy, which finds itself at the cusp of a paradigm shift. In light of this global crisis, and as the world witnesses its largest remote working experiment, businesses need to act promptly and look inwards at how their governance and risk mechanisms can respond to a multitude of changes in the short term and a reshaped future. Today, I think Tawfiq hopes to cover how and support businesses in helping them understand the current situation and how it may unfold into the future, and the steps that can be taken by businesses to mitigate the risks on their own workforces, customers and supply chains. Before we start off, I'd just like to introduce Tawfiq. Tawfiq has been working with Pearl Initiative for quite some time now. He's a partner with many of our initiatives, so thank you, Tawfiq. Tawfiq is the Executive Director of Globesight and a Senior Fellow in the International Security Program at New America. Based between Dubai and New York, Tawfiq leads Globesight, a global development firm working collaboratively with innovative partners to craft solutions to the world's most pressing social issues, particularly in East Africa, South Asia and the Middle East. He has advised some of the largest global health partnerships combating infectious diseases, and has also served as a fellow at the Dubai School of Government as an expert advisor to the United Nations Alliance of Civilizations, whilst also having sat on the steering group for the Project on Cultural Dialogue and International Security at Chatham House. Tawfiq previously worked with McKinsey & Co., the Aga Khan Foundation and the United Nations. He has been regularly published or cited in online and offline media, including Reuters, Financial Times, CNN, Bloomberg, New York Times, among others. Tawfiq received a Master's in Public Policy from the Kennedy School of Government at Harvard University and his AB from Princeton University. Before I hand over to Tawfiq, I'd just like to stress that, as with all of our events and all our webinars, there's obviously an interactive function. We promote open dialogue and questions. So there's a chat function that you can submit questions by that will all feed through to Tawfiq throughout the session, which he'll either address as he goes along or at the end of the session. So please try and take advantage of this opportunity that we have with Tawfiq and get the best you can out of it. Tawfiq, I think you just need to unmute yourself now and you can go ahead. Thank you.
Great, thanks Yasmin, and I hope everybody can hear me okay. It's fantastic to be partnering with the Pearl Initiative once again, obviously in much more challenging times as we find ourselves in. So we'll just go right into it, into the presentation. So just a little bit about Globesight, as Yasmin mentioned. Globesight, we're an advisory platform globally situated in several cities. And what we do from a day-to-day perspective is we advise international organizations and partnerships that are addressing some of the larger challenges around global health, the humanitarian and development sector, And that can include businesses as well as international organizations and nonprofits. And typically we work in the Middle East, East Africa, and South Asia, but often on global initiatives as well. So today, what I want to address in this webinar is intended to provide a framework of thinking about the dimensions of the current COVID crisis and what the parameters you need to consider as organization response in the near and medium term. You can go to the next slide. So the presentation is really geared around 4 segments. So number 1, we're going to be looking at the effect of the coronavirus and the crisis on the global economy, on society, and the business community, really looking at the dimensions of what COVID-19 is, what it's about, what the response has been. We're then going to delve into the overall impact on the global economy. As we know, this is a health crisis, but it's a concurrent economic crisis. And it has that multi-dimensionality where there are multiple impacts happening simultaneously that are affecting each of us in both a micro and macro way. So we'll look at that. And then we'll finally go into how businesses can respond, at least from a preliminary basis. Now, keep in mind, this is an initial presentation and discussion, and we will hopefully have others that delve into more specific impacts and some of the kind of finer details of what this crisis entails are still unfolding. So how best to respond is something that needs to be dynamic, and we'll talk a little bit about that, although we've tried to give some specifics where and when is possible. So going into the coronavirus specifically. So the coronavirus, as you know, was first occurring in Wuhan, in China, a city of about 10 to 12 million people, with the first case reported in initial days to the World Health Organization, and it became public really in January. Now, SARS, as you know, is a coronavirus, as is MERS, the Middle East Respiratory Syndrome, and so this is a variation of that. Now, when it emerged, people were still trying to determine what specifically it was. Was it a new strain? Was it something that was related maybe to SARS? Was it another SARS outbreak? So in those initial days, that's what's being determined. What is the nature of this outbreak? Now, the World Health Organization was involved in January, and that's when you started to have the cases being recorded, the deaths being recorded, and the timeline here just kind of shows a little bit about that. I will say that the numbers that we're using in this presentation are current as of April 1st, so the last World Health Organization report. That report comes out daily around midday, looking at what happened the previous 24 hours. What I will say is that report should be coming out right now, somewhere around this time, and it would show that there's actually, now around 950,000 cases or so. That there have been, for example, a number of deaths on Saudi. There were 10 recorded deaths, but there were 6 additional reported deaths in the last 24 hours. So some of the numbers in this presentation, just like the crisis itself, are evolving, as we go along. Now, what's important to note is that while globally we became aware of and started to track the coronavirus outbreak in early January, the cases that emerged in China actually came about most likely in October and November. And it is not yet clear, even though you've heard many rumors about where it originated. So there's a period of time prior to January where we do not have as much information, and that will be important for people to determine how best to develop the right vaccines and therapeutics. At the same time, there was a laboratory in Shanghai that mapped the genome of this virus, and that's being used in the response. And subsequently, of course, the number of cases that are occurring worldwide far outweigh those that are in China, although we do not fully understand in a transparent way what is happening right now on the ground in China, because the reporting, there's a lot of controversy around that. So if we move to the next slide, what we'll find is that the coronavirus itself is not yet fully understood. Now, we have this name COVID-19. There's an official name, and SARS-CoV-2 that's there. Of course, you've heard President Trump insist on calling it the Chinese coronavirus or the Wuhan coronavirus. There's different types of racial connotations, but then again, MERS is called MERS in the Middle East Respiratory Syndrome, so maybe we need to raise a fuss about that naming. And the naming really kind of cuts, across a series of issues that aren't really at the core of what we are, trying to determine, because a lot of other things are unknown about the virus. We know that it's highly transmissible, and we know that it affects most acutely older people and those with underlying conditions. So unlike the Spanish flu or influenza, again, naming it Spanish, there aren't as many infants or younger children who are affected acutely. And so that's definitely something different. It could change. And people are continuing to track what's happening in the United Kingdom, for example, the United States and other geographies, to see if other segments of the population are more acutely affected. But what we found in Italy was that the vast majority, over 95% of people who died average in an age above 80 and have underlying conditions. At the same time, in Iran, in China, and Italy, where there's been really a frontline approach to confronting the virus, there have been a lot of young doctors who've passed away, young medical staff. And so there is something around sustained exposure to the virus that is being explored. Now, a lot of people have said that, well, the summer is going to come, or, we're going to have a new season, and so we're looking at this for a few months. That's not really been the pattern of coronaviruses. That's a pattern of the flu. But we don't know, right? The SARS crisis dissipated in some ways on itself, just, in addition to intervention that was made. So there are still a lot of unknowns around seasonality, around how infectious asymptomatic patients can be, and even around the mortality rates. Because of the nature of asymptomatic patients and the testing, it's unclear as to what that really mortality rate is. So across a few countries, what we've seen, as we go to the next slide, is that the predominant cases initially originated in China, but now the epicenter of the crisis has been Europe, right? So we're about at 500,000 cases in Europe. The vast preponderance of deaths, and that's across the United Kingdom, France, Spain, Italy, driving that, but also in Belgium, Netherlands, and Switzerland, you have a significant number of deaths, and that doesn't show any signs of dissipating. And then, of course, you have the Middle East, the rest of Asia and Africa that's there. I'll talk about those in a second. But the United States is now emerging as an epicenter. Now, half of those cases that you see are in New York State and predominantly New York City. Now, in one sense, that might show you that there is a concentration in the United States there. But at the same time, what that means is that number is going to spike, because other urban centers are just really waking up to this crisis. Florida just had a stay-at-home order. So we're likely going to see the situation in America spike, where you're having already 1,000 plus deaths now a day. That's going to spike, and we're going to see a very difficult situation over the next 2 to 4 weeks. And that, of course, is going to have an impact on global supply chains, the global economy, and global demand. Now, what we see is that essentially every country or territory has, in a way, been affected already, and there are official cases and recorded cases in most of them. There are some that are still saying that there aren't, but it's pretty much reached everywhere, which is quite remarkable in and of itself. If we just go to the next slide. So what countries have been trying to do, you've seen this is the stay-at-home campaigns, and what people are talking about is around flattening the curve, right? So there's a few studies done around the world, some in Washington by the Institute of Health Metrics and Evaluation, and also by Imperial College, and a few others that are coordinating around the world. And what people are talking about is flattening the curve, and that dates back to a number of studies on pandemics. And you can look at a lot of studies that have been done around the 1918-20 influenza crisis, where social distancing and physical measures helped to mitigate the impact of the influenza and its spread. Now, what flattening the curve is around is to try and lower the transmission rate, the community transmission rate, while you can, one, prepare for the ability of hospitals and medical facilities to take an uptick of people being affected by COVID-19, and then to ensure that you have the right treatments in place, hopefully by the point where you have a higher caseload. It doesn't necessarily mean that there will not be the same infection rate over time in a society, especially over a number of years, but that you'll be better able to absorb that. There's a lot of discussions around herd immunity. You can ask Boris Johnson how that worked out. It's not yet clear, where that plays into this. Now, this is an approach that's being taken by most countries in the world. I would, disregard China because that's an early case. But if you look right now at Italy, Germany and France, they're trying this approach to flatten the curve. And what you'll see in the United States is that different states have already had some middling success there. So Washington State, where you had the first case that appeared in the United States, and the first case of really community transmission that's been documented, you had the governor, Jay Inslee, put into place a lot of practices early on. And if you see the curve, you'll see that instead of going like this, it has gone like this. And if you see the curve in South Korea, you'll see a spike, and then it kind of goes like this. So when they had about a month ago, 800 or so cases a day, and now they're seeing about 150 cases a day. So instead of the curve going just straight up, it goes kind of and curves off. And that's what you want to see in any place, including in the UAE. And the UAE is currently right now at such an inflection point, and which is why you're seeing the measures that if they did not put into place what they put into place, and even further, to be honest, I think is something that we're going to see, then you're going to have that spike. Now, if we go to the next slide, what we'll see in a lot of these countries is that it's not enough to just have the flattening of the curve. Because eventually people need to come out. You can't just have this lockdown where you just disable everything. And while you can see a lot of refrain with the hashtag stay at home and all these celebrities staying at home, although it's much easier for them to stay in their homes. They're very nice homes. For a lot of people, they're not able to stay at home. By the way, who's delivering your packages? There are people who, for their livelihoods, have to leave their homes. And when they are kept at home, you're going to have massive issues in the other countries that we haven't talked about as much, like India, Pakistan, and countries across sub-Saharan Africa. So that is just one step. What you need to have, in addition to the immediate kind of physical closures, external border closures and the physical kind of restrictions domestically, is that ability to do isolation, contact, and tracing. So what we've seen in Singapore, this has been done most effectively. They're consistently measuring people's temperatures, checking them at entry, egress, looking at that in the workplace, and then finding ways to isolate people who show symptoms. What we've seen, unfortunately, in Italy and some of the other cases, they do a lockdown, but they don't proceed with isolation. So you're really isolating people into their families, and you get family infection or community infection. And that's actually happening throughout Europe, which is why their caseload is still quite high. And then once they emerge, we haven't seen a case, outside the early situations in Asia, of a country emerging from a lockdown. So we could see an immediate resurgence at the outset in this first wave, because people have not got the procedures in place to do testing rigorously and isolation. And in some of the Western countries, the isolation tactics would be challenging because you're taking people from their homes and putting them in quarantine centers. And we haven't seen an appetite to do that yet. We'll find out, if that's going to be the case. And I will mention just, the final case here of Sweden. Sweden is currently following the same approach that the UK and the Netherlands were initially following, which is really pursuing some type of herd immunity or laissez-faire and letting people determine what they're doing. But ultimately, we'll see what happens there. There's a lot of now discussion around that policy. Now we're talking here and today about like this first wave of the infection. What you'll see throughout the year, and this is why we don't know as much about what this crisis will entail, is that if it's like the influenza pandemic, there will be a second wave with a different strain, really an adapted strain of the virus. Now that could mean that it's more infectious or more deadly or targets a different, or it could mean that it's less. So there's not like this super virus mutation thing that's definite. We'll find out as the research continues what the nature of that could be. But there will most likely also be a second wave. So you have this first wave, the lockdowns, the contact, the testing and tracing, then you'll have some type of, emergence, and perhaps in the summer in some places people delicately, living in society, no large events, and then the queue in the fall around that time, we'll see, is there a type of second wave or spike or a differentiated kind of version? And that's why you've seen a lot of events like Expo that are in the fall. It's just not clear that this is going to be done by that period of time. And so there needs to be kind of that cautious approach that is there. So if we look at the situation in the Gulf, that situation is evolving. As you know, in the Gulf and then in neighboring countries like Iraq, Iran, and then of course further afield in Turkey, we don't always know what information is coming to us. We know what the public information is. So the public information is that there are 4,000 cases and there are 23 deaths. Now this is, again, like I said, it's gone up. There's two deaths more in the UAE that's not yet reflecting WHO data, as well as 6 in Saudi Arabia. And we're likely to see these numbers grow. Now, Saudi Arabia has been extremely aggressive in its approach, and it's actually quite good to see that that they've been able to get ahead. And now the UAE is kind of also putting into place strict measures. You've seen the containment of an entire district in Dubai, the Ras district, and other Gulf countries are putting in similar kind of procedures. Now, there is no panacea to this. This is a very difficult kind of period, and so expect cases to increase, and in some places expect a significant increase because there's already community transmission we don't know about, we have not tested, that is in the Gulf, and so that's going to become apparent. At the same time, there's a concurrent crisis economically, ingrained within, for example, just the pandemic, but then also that's being driven by the fact that there's been a price war around oil. Others can speak more to it. Obviously, a number of you are tracking this and also work in that sector. And there's a lot of behind the scenes discussions going on. But even now, if that subsides and we might see some uptick in some of the oil prices, the demand, global demand has truly been affected, even though people are looking at China coming a little bit online, in Q2. Now, the long-term solution for the corona crisis is ultimately what are the treatments and the vaccines. And this is where, attention has been, quite little. And we're talking a lot about lockdowns, but the lockdown is really about a delay. It's not a solution. And in my perspective, and maybe we'll be putting out some analysis on it, there needs to be a lot more funds given for the treatment and vaccine research and development. Now, there's two things that are challenging for treatment and vaccine development in a pandemic. To do appropriate R&D for treatments and vaccines, you need to have a control group, and you need to have a random group. You have randomized control trials. So who is that? Who's the control group and who's your treatment group? And what is happening is, if you go, we'll have a case in a nursing home where 99% people opt into having the experimental treatment, like hydrochloroquine that's been used to treat other conditions like malaria. And so you're trying to find out, wait, are there groups that you don't give the drugs? Are you experimenting on people in times under duress? So this is a very complex time to undergo kind of those type of research mechanisms, but people are moving on that. They're fast tracking it. They're trying their best. The three global organizations to think about are the World Health Organization, obviously at the forefront, but they're more policy oriented. So they don't do R&D, but they set the guidelines for a lot of what's happening right now. You've probably been seeing Dr. Tedros, former health minister and foreign minister of Ethiopia, kind of giving his daily briefings. You have the Global Alliance for Vaccines Initiative, Gavi, which is based in Geneva. They're responsible for the global vaccine delivery system, and that's writ large across vaccines and procurement. So they're kind of the vehicle through which the vaccines will go out throughout the world. They're connected to every health ministry, etc. But the primary organization that is driving the R&D cycle on vaccines is CEPI. It's the Coalition of Epidemic Preparedness Initiative. CEPI is based in Europe. They are primarily funded by the Bill and Melinda Gates Foundation, but also other stakeholders. But to be honest, they're completely underfunded. So recently there was a G20 that was held in Saudi Arabia, a virtual summit or convened by Saudi Arabia, where people committed, several billion dollars, maybe up to $30 billion across these organizations. But when you're talking about trillions of dollars coming off the global economy, you need $100 billion. You need it now, and you need to go through the system. And right now, the additional funds that have truly and formally been committed since coronavirus started by international organizations, by foundations, by governments for actual research is in the billions, single-digit billions. And we're still tracking that, but it's to be honest, use a word, it's pathetic. And so if people do not get live and really figure out what is the treatment research happening and what's the vaccine research happening, and let's coordinate, let's share data, let's get our health ministries involved, we're going to be longer in this crisis. Now, all of that being said, there's a lot of small entrepreneurial groups getting out there from different research institutes, from different companies, and doing great work. So it could be that one of them comes through from South Korea, Israel, China, the United States, Canada, the UK. There's a lot of small teams that are out there doing great work, and we'll see something. Now, treatments are what are going to help, once somebody has the virus. Right now, when you have the virus, there's no treatment. Anything can be experimental. They use the ventilators to just help people breathe. It's not a treatment. They're just helping to keep people alive or who are in the hospital and allow them to kind of prolong their ability to fight the virus. But there's no actual treatment. The treatment kind of comes into place to assist you, in that period. The vaccine takes a much longer period, 12 to 18 months to kind of develop it, etc. And then we talk about distribution. So that's a little bit further kind of away. So if we just go to the next slide there. So that's a little bit on the situation overall with regards to the coronavirus. Happy to take more in the Q&A when we have that. But now I want to get a little bit into the impact on the global economy and then around how business respond. And I'll just mention as we go to when I'm saying next slide, that's by my colleague Aline Ati, and she's helped put together this work and done a great job for us. And you'll be hearing more from her in the coming weeks. So next slide, Aline. So there'll be no shortage of shocks throughout the crisis, right? We've seen things that are unprecedented, never seen before, right? From travel bans to projections around, third GDP cut in the United States. You're seeing ratings cuts, renewed liquidity crises, and projections of recessions at the scale of the Great Depression. So this is something where every day, every 24 hours, you wake up in the morning and you see another series of headlines, and you're like, what now? And even if you're getting desensitized, something else comes. That's the nature of this crisis. Sometimes every 24 hours can feel like a month. So specifically for the economy, what we've seen kind of occur so far, just looking at the charts here, is that the indices around stock markets, obviously you've been tracking, have fallen, some by a third, etc. And they made some rebound, especially as governments around the world converged on a stimulus. You saw that in Canada, the United States, in Europe, here, Turkey, even Iran, India, all over. You've seen different types of stimulus packages, and that's been very clear that needs to happen. And governments have been actually quick to act, thinking about unemployment insurance, health coverage, understanding to kind of put funds at the disposal in terms of lending and liquidity for companies. I would say that in the Gulf, it's more announcements and more difficult to access, and so that's something to think about on how you respond and how to make sure you're getting what is really being allocated. So that's one on the indices, but I think the true kind of impact is really on the manufacturing and the production, and then the unemployment. So China somehow, if you believe the numbers, has seen no drop in Q1 of their manufacturing index. You can take that to the bank if you want. But most countries have obviously seen a dramatic decline. In the United States, we just got new numbers. We're getting new numbers as well. But that's just the nature of it. I mean, from a common sense perspective, the stoppage, and that's affected employment. So we're seeing record claims around the world on unemployment. And the ILO estimates 25 million. I think it's an underestimate of what we could see the longer this crisis goes on. I mean, we're going to have unprecedented levels of unemployment, easily 30% in many, many countries. And how that affects transient societies or with large expatriate populations like the UAE, that's something you really need to keep in mind. And then the follow-on effects from a consumer cycle, from long-term banking relationships, etc. So we're going to see this kind of continue kind of as we move forward, but it's obviously a bleak situation there. And while there is the notion that there will be like a quick rebound, because this is something that, you know, is really a temporary situation, the longer this continues, the rebound becomes more difficult. So we'll see what occurs kind of going forward and see if there's some type of rebound that's quick, but we'll talk a little bit about that in the coming slides. Next slide, please, Amin. So we're seeing different challenges across industry. So some of you will still be seeing cruise ships still floating around. They're obviously very affected. I don't understand how people are still getting on cruises. I think they finally stopped, but there's still a few just kind of ghost ships that are circulating. But air and travel is just completely decimated. It's halted now. The question is, when does it restart? But restarting is about two things. You know, when we talk about air travel, when we talk about some of the larger airlines, etc. One is about the health and safety measures that are in place, and that is coming from the government. And the other is actually from the capabilities of these airlines to adapt, right? So if you have routes and you have very fine-tuned logistics, you're not able to just run 1/3 of these routes or run these specific routes. You're really going to have to do some deep thinking around the logistics and efficiency. And so we're all going to be facing, as businesses, as others, a significant challenge in air travel over the next 6 months until you reach some type of steady state. Across other sectors, insurance, telco, energy, automotive, retail, many of you are facing these challenges. I'd love to hear a little bit about that, you know, from a consumer perspective, from a finance perspective, and some of you are facing them within those sectors, and some of them you're facing them, you know, as you're utilizing those sectors in your core day-to-day. But what we've seen is that there's so far not a complete breakdown in the supply chain. And so that is, I think, the thing to look for in the coming 1 or 2 months. As the restrictions have gone up around air travel, for example, and trade, we've seen that most trade and cargo has been allowed to move forward, but you now have different type of supply shocks coming into place. You know, one is around, let's call it country level hoarding. You can see that most acutely in medical equipment, and that leads to a breakdown of the regularized supply chain. And then you have, you know, situations where you have essential equipment and essential inputs, and so countries are restricting that. And now we're seeing on a food security level, certain countries are restricting different food exports. So we'll start seeing kind of an increase in those type of impacts as things go along. And so you might find somehow a supplier you're using just can't produce your goods. And obviously now you can't produce your goods there. And then from a service related thing, you know, for example, if you're in Iraq and you are running an oil and gas company, you have kind of staff that are coming in and out, right? So people aren't there for an extended period of time necessarily, but now you have that rotation is in trouble, because if you take them out, can they come out? Can they go back in? Or the people who are out, can they go in? So do you keep them there? So what you do with that, if you have a business that's based on that type of staff kind of churn on a short-term basis. So if we go to the next slide. So overall, just, you know, kind of looking at this impact on the global economy, and now we'll go into the response, is that multiple dimensions of this crisis, A, are unprecedented, but B, are also unknowable, right? So even what we know today and what is then coming, we don't fully know. And what we don't know, as Donald Rumsfeld, who I'm not a fan of, used to say, what keeps him up at night are the unknown knowns, right? So what is it that you don't know you're supposed to know? Right, and that's what's really around the corner. That makes it super challenging if you're managing governance and risk. Is how do you know what you don't know? You're supposed to know that you don't know. You know, so all of this, right? You'll fall apart if you start thinking like that. But that's what's really kind of happening. So you really have to be nimble, adaptive, dynamic, keeping the channels open to really continue to digest information. And manage in the right way, not to over digest, because some of you, I'm sure, on Twitter and social media, and then, you know, it can be depressing, or you can get a headache. You can overindulge. Everything is Corona content, you know. So you don't want to over do that, because you do want to be able to make sure you're doing it in a manageable way and not reading every conspiracy theory video that's WhatsApped to you by your family member in a different country. So keep a focus, but do continue to digest information. So go to the next section here. So, how can you respond, right? I mean, that's what we want to start the discussion today. And it's not fully clear because they're in an unprecedented situation. You are not going to have the perfect response. But how can we begin to look at this? So we look at this in 3 different ways. So one is react, the second is adapt, and the third is contribute. So react is tackling immediate priorities. Now, people often will tell you in business management, don't react, right? You have your strategy. Well, this is the upside down scenario. So you want to be very reactive. You want to be very sensitive. You want to adapt quickly. You don't want to not overreact. You want to overreact. If you know that there's a shutdown order, shut down 1 week earlier. Don't wait for the government to tell you to shut down. If you are being told this is the minimum level of protection, go to this level of protection. So the first situation is to overreact. If you have a liquidity position, solidify it, cut costs immediately. If you're thinking of a salary cut across your staff, talk about it today, not put it as a contingency 2 weeks from now. So you need to tackle immediate priorities right away, ensure the continuity of the day-to-day operations of your business so that you can start to adapt in a steady state in the crisis situation. So as you adapt, this is about putting into place the right mechanisms. So look at your governance, look at your risk mechanisms, and think about how you can adapt them to be operable in the current situation. Now, what we're not talking about is actually changing your governance. What you want to make sure is that you can execute your governance mechanisms in the current environment. So that's much more on a modality. People might think, okay, I need to change the nature. No, now is not the time to change how you make decisions, because that's going to throw you into a little bit of chaos. What you need to make sure is you can enable that decision making. We'll talk about it a little bit, but when you have meetings, are they virtual? Can you have participatory decision making? Can you make board decisions? How do you do secure voting, etc., signing of documents, etc.? And then the third pillar here is contributing and doing your part. Ultimately, people think about contributing as an ancillary aspect and saying, oh, I'm doing good. This is not doing good. This is doing your part. Each of these crises, each dimension of this crisis is local, it's national, and it's global. And wherever you are playing and have a footprint, you need to be contributing, because if you do not, and if organizations do not, this whole response will fail. It's literally at that level that you need to make sure that you band together with your sector, your industry, to keep things together. This is beyond any one organization, and no government is going to solve this. It requires a multi-sectoral, cross-sector response. No one is insulated. So you need to think, do I have supplies that can be helpful? Can I ease things, in the local community? Or do I need to change my manufacturing line to support something around PPE, protective personal equipment for medical staff? This is vital, and I can't understate that. So you go to each one of these kind of pillars. So, we've seen in the UAE and globally businesses, addressing things in the short term. We have examples from Emaar, Amazon, Do, Microsoft, and others looking at this across a workforce, supply chain, their customers, financials, and a technology perspective. Obviously from your workforce, if you haven't figured out working from home for all the non-physical activities and even some of the physical activities, you need to do that now. Don't wait for the government to restrict you. You need to over comply. You need to over analyze where you can do that and put it into place. Now, Emaar moved quickly. They are operating. For example, that's one to look at. Supply chain, look at what's essential, right, in your current market dynamic. Whatever is not essential, try and scale it down. Obviously, you need to think about your cost of restarting something if it's manufacturing, or if it's a supplier relationship. But you want to prioritize your essentials. So Amazon, for example, they're saying, what are the biggest essential items that are selling that are needed right now? We're going to focus on our energies. Now, obviously, Amazon is exceptional. They're having revenue growth during this period, but it's a great example to look at, so then they can concentrate how to meet the surge of demand for themselves, but also kind of minimize costs elsewhere. Now, I would posit it's a good example in one sense, has not gone far enough. The fact that we don't have all of the VoIP technology green lighted, it's unfortunate. It's actually, I would say, a health risk. So if I spoke to if any of you are from you need to have a closer look at yourselves to understand how do you get more on board on the current situation. But at the same time, that is difficult to change a long-term policy. So has done some great things, which is around consumers and providing short-term relief, providing free upgrades across the board. So, there are obviously going to be regulatory challenges for large players, and they can't move everything, but where you can move, you should, and that's what has done. And then, we have a couple of other cases that are there, but there's so many out there that you can be kind of learning from and looking at for examples. So when it comes to governance, you can look at this in many ways. We're just looking at it from the structure, the oversight responsibilities, and human resources. I think a core message here is you want to maintain your core and basic governance structure. And what you want to do is make sure you have the right infrastructure to enable that. So if you have committees, the board should regularly meet, the committee should regularly meet. You should there's functions that you can have out there to allow for voting, etc., even anonymous voting. So you want to get those mechanisms in place as you need them to allow for those participatory decision-making bodies to continue to function in real time when they need to. And everybody, you need to ensure your quorums. Nothing should really change there. Obviously, there's going to be logistical challenges, but that's what you want to get on top of. Now, you might want to consider having a temporary coronavirus crisis committee. All of you are used to having that, whether it's been around the Arab Spring or the financial crisis prior, or the oil crisis. I'm sure you've had those type of ad hoc crisis committees, and now is the time to kind of make sure you have one, and that is multidisciplinary, right? So it's cutting across. You might want to have an external advisor on there as well, depending on what you're looking at. Now, in terms of kind of oversight responsibilities, you want to make sure that there's an increase in cross-functional collaboration and coordination. You might actually have a breakdown of that if you're having the remote working. So you want to see, how do I have the right communication channels? How am I maintaining my supervisory functions on a day-to-day basis? That's very important. And you're going to have some staff turnover and change. So you want to get ahead of that regarding knowledge management and having business continuity kind of in place. And finally, you want to make sure that you're having the right transparency in this time so that you can make the effective decisions that are happening. And a point just to cross on oversight is quicker decision making and decisiveness is important in this crisis. The longer you wait, you're already behind, right? So you wait, next day situation has changed, things are unclear, and you, as people are diffused, as your organization is diffused, you can slowly lose control. You don't want that to happen. Finally, along human resources, you need to make sure on this that all your staff are okay and they have the outlets that they can go to and they are protected in terms of their own, situation. And I think from an HR perspective, that's something very important to look at with your HR teams and have a very comprehensive plan in place. If we just go to the next slide then. Now, there's a lot of risks that you're going to be facing that you're going to want to discuss, and then the crisis committee we should be looking at. These are spread across strategic risk, operational risks, and financial risks, and they're going to be evolving. And there's a lot that we haven't even included on here. I mean, your risk matrix is going to be off the charts when you're looking at coronavirus because this is a multi-dimensional, multifaceted, interconnected crisis, right? And you're going to be facing risks all across the board in every aspect of your business. Now, some of the macro risks that you really are going to have a difficult time in addressing are around the macroeconomic situation. That's just going to be there. So you're going to have to manage your business to operate in that environment. The supply chain we talked about and looking at how that's functioning, and that, having that day-to-day touch point in real time with suppliers by WhatsApp, just to understand the situation that might not be reflected in numbers, very important. You do not want to be blindsided when things change, and they are changing daily. And then in terms of the market and customer, assume your customer in most of the sectors, unless you're online or doing online delivery or doing kind of delivery of goods and services that are required in this time assume a massive disruption in your customers. So you need to adjust your cost basis, reposition your staff, where if they're on that consumer facing environment, yes, have people to maintain, consumer facing, but think about if you can reallocate that staff. And it takes us to workforce. Your workforce is going to be under tremendous strain, morale, pressure. You're going to see things that you're not ready for. There needs to be ways to think about flexibility, and you could, sometimes like this, you can end up putting more pressure on your workforce, but that can have the adverse kind of effect. And there's a few other here that we can go into, but let's maybe move on to the next slide. So how do you respond? So you have 3 levels here: within the organization, in the local community, and then at the national, regional, and global levels. Like I said, within the organization, don't underestimate your ecosystem and what you can do. Looking at the mental health and well-being of your staff, even looking at mindfulness, looking at kind of doing some type of virtual seminar, very important. Let people opt in if they want that. Make sure that there's outlets that you're able to reach people. Look, you're not seeing them every day for a lot of them. And don't assume that doesn't have an impact the longer this goes on. You need to find ways and outlets to check in. That's very important. And communicating openly and with empathy. Now, in the local community, this is where you're going to see immediate needs. You can see that in the UAE. There's a lot of organizations that are stepping up, that are looking at, for example, some of the laborers, some of the others that have needs. And don't forget, if there's a weak chain in your local community, guess what? That infection rate's going to rise, and it's going to come to you, right? So don't think you're insulated if you're in Arabian ranches. Nobody is insulated. The Western Europe has been the most hit. So you need to look at your local community and say, what can I do? Where are the needs? What can I provide? How can I help? And then at the national, regional, global levels, you're each going to need to look at what you can do and if you can repurpose or need to repurpose. So there's even companies here in the UAE that repurpose for manufacturing, for hand sanitizer, etc. Not for gouging, right? Don't think of this as I'm going to become a big business leader during this time and providing essential equipment, but being that kind of response first line mechanism, that's going to be very important. Next slide. So we've obviously talked in this presentation around the near term, and it's important. You need to react, you need to be ready in this immediate term. And a lot of people are talking about the post-corona era and everything is going to change. And how do we adapt, or how do we take advantage at the bottom, of the market? This is a crisis. It's not going away. It's here for a little while. And it's pervasive. So you need to respond right now. Now, maybe in 1 month, we can have a better discussion around the recovery period and then how you renew and actually be prepared for that new normal. A lot of people are speculating. You go on Foreign Policy or Wired magazine of the new world. Obviously, they didn't see this coming, so they don't know what they're talking about. So you need to really think hard when people talk about the new normal. Let's let the dust settle to really understand what that's going to be. Definitely being prepared on emerging from this current state. You will want to start thinking about that maybe in a few weeks' time. First, get yourselves really positioned in the steady state. It's going to ebb and flow for a while, and then maybe in a month or so, you can start thinking about how you deeply recover. Obviously, you can have people starting to think about that, but you really need to make sure you have the response in the near term figured out. And that brings us to Q&A. I know we have less times than we wanted, but I'm happy to kind of take any questions or take your discussion. I think you can use the online mechanism to put in any questions there in the chat. So I think, one question is, what's your view on restaurants and how customers' behavior will change? I think we're all seeing that, from the food and beverage industry, everything is online. But what you need to also think about is, people may also start to consume less in terms of F&B. Think about, going, obviously groceries, etc. So what you see in globally is some of the businesses like Blue Apron, etc., have had growth. How behavior change will, happen over time? We don't know, but obviously the longer this goes on, there's more to look at in terms of behavior change. Elizabeth Kurivila is asking, with so much uncertainty as to when we can go back to normal operations, what, in your view, is the optimum period that I should keep financial reserves for? I.e., when should we start cutting costs like salary, etc., when we have reserves for just 3 months? I would start cutting salaries now. If you can make short-term salary cuts, that's fine. If you have people who have paid leave that they can take, have them take it now. If you have people who are willing to take some unpaid leave during this time, have them do that now. This could go on, I think, in the short term for 2 months. But like I said, it might ebb and flow. So you might come back with restrictions, or you might be emerging in a restrictive kind of period. Walid Ajlan has asked, he said he's actually echoing, saying that we should be proactive. What about the competition and losing customers and not retaining them? Yeah, I mean, I think this is a time where you want to band together with your competition. You want to take a sectoral approach, look at your business alliances, group in there, because if you kind of move into just a competitive approach, there isn't enough of the pie to look at. So you really need to be kind of looking at this collaboratively. Naveed Saeed has asked, do you think the oil war will also continue for some time between the oil producers? Of course, this is beyond your control. I think from a governance and risk perspective, you need to assume that this could go on for a while, but then it could radically shift, right? So if you're just preparing for a lower oil price, and then you see one shift happen when you have the oil price, conflict between Russia and Saudi resolved, and then another one maybe when you have some uptick in demand, you're not going to be prepared. So don't fully adjust to saying this is the new normal with oil prices. Brooke Horowitz has said there are quite a few examples of companies not doing the right thing. How should we call out companies that are not contributing or even benefiting from people's difficulties or misfortune? I mean, I think this is a job of the media and the press. Especially in countries like the UAE, you want to be careful of what you're putting on social media. There's an extra, and it's actually a good sensitivity, because we don't want mistruths out there. We don't want rumor campaigns, and it can be quite difficult because we're trying to have a national response if people are tearing things down. So when you can be constructive, like on Do, say, hey, this is what I suggest. Can you do this? In terms of calling out companies that are not contributing, I think if there's a safety risk, please look at that. Otherwise, if there's something specific, you can go to this site. It's Wikaya. It's the site that's I think it's set up by the UAE government. I'm using the English pronunciation, and you can look on there for a contact point there. Hanan has asked, in your opinion, how will this crisis affect the green and climate change agenda, both global and local goals? Well, COP26 is likely being postponed later this year, so that's another kind of consultative dialogue being postponed. As you're looking at your own climate metrics and how you operationalize them across your business or organization, I think the same metrics will apply, but now we're seeing obviously globally emissions down, activity down. You've seen the maps even from space and then in cities, how things have cleared. So obviously in the short term, there's less emissions. But I would argue that likely the world will be longer to snap back to aggressive climate measures because they'll want to restart industry. But in the long term, we're not going to see a change because I think there will be a more acute attention paid to kind of global challenges. But in the short term, you'll see that being less importance. One of the people says, kind of to keep anonymous, is convince us that the WHO knows what they're doing. Encouraging people not to wear masks seems to have been a sort of misnomer, perhaps to preserve them from medical personnel. So how do we deal with when the authorities themselves at a global level aren't providing clear information? How do you even maintain the guidelines for your organization? I think you need to look around. You can't just take one perspective. Definitely look at the institutions I mentioned, WHO, look at your national authorities. That's the best guideline, the local guidelines. But then look at some of the reference points and experts. Do not look at random things coming by WhatsApp. You look at them, amuse, but look out there. And if you can take a consolidated view and you can look at what the South Korean authorities are saying and you can look at what the Canadian authorities are saying. So there's enough authorities to look at, and then you have to make a common sense, educated decision. And around masks, I will say that most of the guidance is now shifting towards wearing masks, not as a panacea, but as something that is just one additional measure that's going to help you kind of going forward. So we have here Mona Ismail has said, how about higher education? Institution is not prepared for distance education. So definitely education, and if you're providing that for your staff, and then if you're pursuing it for yourself, or you know, I think a lot of institutions are prepared for distance learning, and some are more prepared than others. The UAE will need to radically think about it because it has private institutions and at price points that aren't reasonable, especially at the secondary and primary level. And so we're seeing price cuts now being offered. I think you'll see education as a sector that will not come back in the same way. But you will find that on terms of universities, they are adapting, and you'll see in September, actually, many of them will be online. They won't even have matriculation. We have here a couple of people just saying thank you for the presentation. From Nilesh, any idea when is travel expected to start and what after the lockdown is over? Again, from the UAE, we'll evaluate, you know, in the coming week, next week, about what's happening. Is there going to be an extension? We will find out, right? I mean, I think this is a fluid situation. Likely, we're going to see some near-term travel resume at some point this month, but it will be limited, both from a commercial basis and a security basis. And you could see restrictions come kind of back up. Bob says, organizations usually tied by government directives. If today was 1st January 20th, what should governments be doing differently from what we know on April 2nd, US, Europe? Yeah, I mean, we can't go back in time. I think what you do is you start the restrictions and the testing and tracing earlier. You'd rather be in the Singapore situation. And so coming out of the lockdown, you want that where you are able to test and trace everybody rather than just going towards a lockdown, because the lockdown is not a solution. And even coming out of that, you need to have that. And then I would have a stockpile of certain type of medical goods kind of in place in country. And then finally, I'd have a much better communication mechanism between the government and businesses. So when you have a stimulus, you can kind of cut it through. Walid asked, are we going to have a new corporate governance framework post-COVID-19? I'm not sure. I mean, we'll see what we have. I think, like I said, we're doing some thinking around that. But you're definitely going to have a more nimble and flexible architecture that can enable quicker decision making and remote decision making. Nasser asked, how about micro companies? Do you think they can benefit from this crisis? I think micro companies have an ability to scale down their costs, but then they're also subject to the vicissitudes of the market. So the key for a micro company is to be able to lower your cost so you can readapt your business model during this time so that you're more efficient and effective kind of coming out. Naveed asks, how can employees contribute or help their employers during this crisis? Definitely, employees showing flexibility is important, but I think employers need to help their employees as much as employees help their employers. But many employees, if you have an honest conversation with them, you can say, hey, what about a 20% cut on can we do this together for 3 months? We'll come back, if we come back strong, we'll make it up to you. A lot of them understand the crisis is better than losing their jobs. They're going to be coming with you. We have a lot of questions. Noura asks, what about the startups in the market? What is the main steps I need to follow in terms of establishing it once the crisis is completely done? I think you're going to see a lot of free zones put up, a lot of discounts and new kind of procedures. So keep track of them, what they're doing, and make sure you adapt a flexible model. Be careful about all the fixed costs you lay down. You don't need an office. Take advantage of the remote architecture. Every company will be operating in some way, shape, or form like that. Roxana has asked, are people going to be, not willing to follow directives and rebel? Yeah, I mean, definitely there's going to be, people who are going to not follow directives. You need to figure out what are the review mechanisms that you have and what are the incentive mechanisms that you have that continue to motivate your employees to kind of, act in this kind of environment. So Hanan is saying that some operations will come on Emirates April 6th. That's what we're projecting. Let's kind of see what's there. We have a lot more questions. I don't think we're going to be able to get to all of them. Just to address one last one. What are the resources you found best to look at the impact around coronavirus? I think you want to follow some individuals, people like Muhammad Al-Aryan. You want to follow them, the Fed in the United States. I think you want to look, I mean, The Economist is good at kind of measuring some of the metrics. And then I would just also keep a track on the WHO and those parameters. But this has been great to be with you today, and thank you to the Pearl Initiative for offering this opportunity to give a very interconnected approach. I know we spent a lot of time on different dimensions, but it's important context to have to really understand how to respond to this crisis. So thank you.